All right. So, yeah, this is the talk I gave in Istanbul back in May. And basically, what we talked about were basically metal allergies and reactions, and basically the evaluation of the interaction between dental and orthopedic metals and systemic effects. So, as a surgeon, foot and ankle surgeon, I put in a lot of hardware in my patients over the years, pretty complicated surgeries, and a lot of different metals. Typically, what I had to work with were titanium and stainless steel, but all of them were different alloys. All the titaniums, different companies had their own special alloy that they would use, and so it's not they similar. So that was a problem, as I found out with some of these. So over my 30 years, thousands of metallic implants I've placed, and then it was a couple decades ago when I started realizing there were some problems in some of these patients, to the point that 10 years ago I started giving it more of an option, like we discussed, for patients to have things removed, and vast majority of them did. So I removed over the last 10 years of my practice in excess of 1,000 metallic implants in over 400 patients, and then started and really had a high index of suspicion for these metal reactions. Presentations I've given, Australia was probably one of my first ones, at least internationally. I gave a number of pain management seminar talks, but then out over in England, and then one of the big ones was with the FDA, with the Medical Device Advisory Committee back in 2019. And that was quite interesting with a big panel there. We discussed a lot of different things. Turkey a number of times, Egypt this last year, and then most recently, like I said, was over in Istanbul. And essentially, what I am presenting is cause and effect, meaning metal implants were placed in the body and certain symptoms developed. And most of these were basically patients and implants that I placed. And then the metal implants were removed and the symptoms improved, or vast majority of the time resolved. So here are just some of the local signs and symptoms: localized swelling, pain, stiffness, localized rashes, electrical shooting sensations radiating from that area, inflammation reactions around the surgical site mimicking infection. And I kind of wonder sometimes too, John, just some of this when I'm seeing this with some of the titanium and or stainless steel, and then mimicking infection, but I culture it and it's not infection. It's just an inflammatory
Uh-huh.
reaction from the metal
Yeah.
itself. And kind of wonder about that with some of the metal work that you guys do sometimes.
Yeah, I've seen that many times where you'll have gums that are irritated around a certain alloy of crown material,
Hmm. Yeah.
and that alloy is generating charge because it's next to a mercury filling, or there's a mercury filling in the same mouth, and you've got these electrons flowing around and a battery potential develops, and then the gums get irritated. You take the crown off, put a all ceramic crown on, and everything settles down.
Yeah. That's exactly like one patient actually is similar to the surgery I just showed you, where I had a plate and screws on like the second metatarsal, then a K wire. But there's only one company that makes titanium K wires, and the pin in the toe, and it's a different than the company in the foot. And I even asked the both of the reps ahead of time. I told them, hey, I have to use titanium, your pin and your plate, and they go, it's fine, it's all titanium. Well, it wasn't fine. I had a reaction, it looked infected. It was a nurse from the local hospital. And, I cultured it negative, and I ended up taking the pin out early, at about 4 weeks instead of 6, and then splinted the toe. And then immediately, by the time I saw her next, everything, the quote infection that looked infected was completely gone.
Yeah.
And everything had dried up. And it was just a reaction between the two dissimilar metals, even though they were both titanium, they were different alloys.
Yeah,
So,
and to your titanium, the titanium that we're using isn't 100% titanium. What in your world, what is the ratio? What other elements are thrown in with the titanium, just for my
yeah.
interest?
Yeah, so it's Ti 6 Al 4V, so 6% aluminum, 4% vanadium, and then the balance is titanium. But
Uh-huh.
even with that, with the corrosion engineers I've been working with up in Canada, we've been breaking those down with what's called ICP-MS, or inductively coupled plasma mass spectrometry, and it can go down to a thousandth of a percent of weight. And we found in one of the cases that actually is coming up that they we had like 17 different metals in that alloy, the titanium 6Al4V. There were 17 different metals.
And
So
these are elemental metals that you're speaking about. There's a little iron in there, there's a little, right?
nickel.
Yeah.
He was allergic to nickel. That particular patient's allergic to
Yeah.
nickel, and there's 0.013% nickel in that
Yeah.
implant, and that's
Yeah.
all it took for him to get a reaction to
Yeah.
it. And he certainly may have had other galvanic reactions going on too, but he
Yeah.
had dramatic symptom changes after removal of that hardware.
Yeah,
So
we have
yeah.
nickel in some of our dental metals too, and that nickel is common allergen, as I know you'll share.
Yeah, well, here's a gal, young gal. This was actually an orthopedic surgeon's daughter, who he knew I was into this, and she had surgery, 3 hours away from me, and she had asked the surgeon to use titanium because she was allergic to nickel, and they did put a couple screws in her foot. Titanium did fine. Then the next year, she had surgery on the opposite foot. Well, she forgot to mention, or the surgeon forgot to look, that they used titanium. They used stainless steel in the next foot, and this is what happened. These are
Wow.
just from nickel allergy from screws in her foot. So it could be, like I say, all over systemic symptoms. And this was happened to be a rash, and then she had those removed and went away.
Was
So
this rash on the same side that the stainless
no,
steel?
it was all different areas of her body. Yeah, it
Oh,
wasn't just
okay.
on. Yep, it was on
Yeah.
her back and other side and everything. Yeah, yeah,
Yeah.
yeah. Pretty impressive from just two little screws in a foot, huh?
Yeah. Yeah.
Yep, and I've seen that many times when I've had hardware and not just stainless steel, but titanium also, and then the rash goes away typically within 4 or 5 days after removing it.
Scott,
So,
you
uh-huh.
know what? And we can see the skin rash. We could also be having inner reactions in the gut where this
Oh
lining
yeah,
of the
yeah,
that could be
yeah.
super upset by this, but we can't see the rash in the gut.
No, we cannot, and I'll see that with irritable bowel syndrome, Crohn's disease, all this. It's an inflammatory reaction, right? And this just happens to be the skin manifestations of the inflammatory reaction. So
Yeah.
you're exactly right. It can be within the joints, and that's what I'm getting into next. Actually, is here are all the systemic symptoms that I've seen, and muscle spasms of the legs, back, neck, full body. The neck seems to be a red flag for me when I start interviewing patients about metals and systemic symptoms. I'll ask them about neck pain. Oh yeah, my neck. When did that come on? And find out it came on within a number of months of getting this particular surgery or something. But neck seems to be a pretty sensitive area for some reason. Back and also, but neck seems to be more. But other things, fibromyalgia like symptoms, joint pain throughout the body. It doesn't matter whether it's the hands, knee, back, elbows, shoulder. Shoulder, I see a lot of problems with related to hardware someplace else in the body. But severe fatigue, chronic fatigue type syndrome, and that they were diagnosed with sleeping disorders, migraines, uh, dermatological conditions. We showed, emotional, mental health issues. A number of people with suicidal ideation that I deal with from around the world, just because nobody, the docs won't listen to them about this. They feel that something is going on. They knew it came on after this particular surgery, but the docs don't understand it and
Yeah.
haven't really heard about it before. And then here's the GI issues with the IBS, etc. And one of my cases had chronic diarrhea after I had, and she didn't get it. I didn't know she was having it. I operated on foot. The skin was titanium. And she came back a year later to have me remove the hardware because I told her, we could remove it. And she was getting a little irritation from it. So removed it. And then she came back. She goes, guess what happened? I go, what? She goes, my diarrhea, chronic diarrhea that I had, endoscopes and colonoscopies and all this different tests for. I mean, it was just bad. nonstop. I look back and it started like within a few days after that surgery because I knew I had problems. And then you took the hardware out a year later, and within a week, it was gone. My chronic diarrhea was gone. So, yeah, these are the things that can happen, like you say, inflammatory reactions elsewhere in the body, not just on the skin. So, yeah, and then exacerbation of all kinds of different rheumatological conditions, whether it's osteoarthritis, rheumatoid arthritis, lupus. Actually, one patient, it was another nurse who had lupus-like symptoms. She was seronegative, so she didn't have a positive ANA or what have you, and so she was negative that way, but had the same type of symptoms. And then she saw all kinds of doctors. Finally, went to a certain doctor over in Seattle, which is about 3 hours away from us. Said, "Hey, you have a lot of warmth over on this side, and you have these amalgam fillings over there. I just recommend you get rid of those." She got rid of them. All those symptoms disappeared. And then I operated on her with titanium, and guess what all came back?
Uh-huh.
All those symptoms. But then I removed the hardware, and guess what? Guess what all
All
went
went
away?
away.
Yeah. So that's how we have to learn, about this. So a paralysis case that I'll show you, stiff persons type syndrome, that is quite elusive for the medical society or medical, basically community here. But I've had probably 3 cases of this now. So nerve pains radiating throughout the body, and then reaction of hardware placed like in the foot that causes problems with hardware in the back. Where I had stainless steel in the foot, the patient had some back surgery with titanium for back fusions and had chronic pain there. And I ended up removing the stainless steel from the foot, which is a different, that's a different alloy. Well, obviously, the stainless steel, we'll talk about that more coming up, but there's different charges with these. And I removed the stainless steel from the foot. This back pain that she had for years, that was 7 out of 10, went away.
Yeah.
And they left the hardware in place. So,
Yeah.
but here's a paper that we had discussed previously, but this came from the FDA and biologic responses to metal implants. And this is September 2019, and this is just before I presented to the FDA. And they go into everything we're talking about, all these, and things that can happen with metals, and including cardiomyopathy and GI symptoms, cardiac issues, Alzheimer's, headaches, psychiatric symptoms, GI symptoms, Parkinson's like symptoms. All these can be related to metals in the body. And these are papers they went through. Paper is 149 pages. Probably 50 of it is all references that references all these things that can happen: weakness, tremors, and vanadium. So tremors and vanadium, weakness, headaches, GI symptoms. Well, vanadium, like we were talking about, is 4% in a titanium alloy.
Yeah.
So there you go. And and it goes on and on and on with all of this. And this is a paper. If somebody really wants to get into things, this paper, a comprehensive summary of disease variants and metal allergy. This is by Roche, and this has been an incredible paper. And it's out of the National Institute of Occupational Safety and Health and Allergy and Clinical Immunological branch there. And this uh, just an incredible summary of all these different problems. And people can go back and look at this and kind of see some of these. But again, we get into all the skin conditions. And then here is the geographic tongue, burning mouth syndrome, oral lichen planus, all of these things with the mouth. And then also eyes and all this too. And I've seen, multiple eye issues, whether it's temporary blindness associated with metals in the body, um, and or double vision. One of the dentists who presented with me, he had multiple metals in the mouth, and his patient, had this shoulder pain. He took one of the metals out. Oh, my shoulder pain just went away, and then he took another metal out, and I can see now. Had blurry vision, but now I have clear vision. And then another one was ringing in her ears after we removed another metal from her mouth. And he said that's the same type of stuff Dr. Scott was presenting at the last lecture. So same type of thing. But again, allergic asthma, I've seen this, asthma, exacerbated when I had metal in their body, and then it resolved after I got it back. So all kinds of different things here associated with this. So this is, like say, a great article, and rosacea and psoriasis and chronic fatigue syndrome, fibromyalgia, everything we do, ulcerative colitis. I mean, all this stuff. Uh, so it's all here. It's not just me saying this and seeing it with the patients. It is here. So pretty impressive, huh?
Very, yeah. I'd love seeing the government or these good articles, getting out there. Now we just need the medical community to be exposed to them and read them.
Yeah, that's one of the things. The FDA puts this paper out, but nobody reads it. The
Yeah,
doctors aren't. They're too busy. We're running here, and we have all this other stuff going on, and it's 149 pages. Who has time to sit down and read that? And so that's where, if we can get some of this in a condensed form to get out,
yeah,
and that's where some of these, even fine tuning some of the podcasts or what have you, to kind of boom, 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 to get some
yeah.
things out. But here is,
Out of
this. What's that?
out of the 149 pages, how many pages are just a chart of symptoms? They have 20 pages and just the charts.
They actually, those are about what I use. There's probably not 20, no. But what's nice about those, why I like those charts, because just boom, you can look at them real quick. You know,
Exactly. If
yeah,
just the charts were put into a booklet of here, this is a 10-page booklet of the symptoms of these different metals, and these are what's in your plates and your screws and your hips and all that we're using, and again, like you suggest, make this simple for somebody just to be able to peruse it quickly while they're watching their child swim meet. And it's like, okay, well, I
yeah,
can deal with this while I'm here,
yeah.
but you can't take on the 149 pages.
Right, right. So you're exactly right, and so I think the Roach article is probably even better, because it kind of consolidates all the things and kind of puts them in different groups.
Yeah,
So that's what's really nice with that, and yeah, so that is one thing definitely that would be good to get out there.
yeah,
So this is 5 ways, and there's 6, and probably more, but these are just kind of some of the basics, as far as some of the ways metals can negatively impact the body. So physical or improper placement, impingement, and you'll probably see that if somebody is not putting a dental implant in properly or what have you, so you get pain or that type of thing. Same thing in orthopedic hardware, depending on the position and improper placement or so. Infection, always has to be ruled out with any of these things.
yeah,
Toxicity. Toxicity is a big thing with a lot of these metal on metal hips, and then cobaltism, that type of thing, and then you have excessive metal ion release into the body, where then you get toxic levels. Uh, or the toxicity can come from corrosion, and then again metal ions in the body. And everybody seems to be a little different with some of that, but they have some of their guidelines for the toxicity of that. But then we get into allergy or hypersensitivity, where it doesn't take much in the way of metal ions to have a problem. It's like, your child. If is it okay to feed, if your child's allergic to peanut butter? Is it okay to feed them just a little bit of peanut butter?
yeah,
You know, right? And
yeah,
same thing with metal in the body. Are you allergic to nickel? Is that, oh, but it only has 0.013% nickel. Yeah, but if they're allergic to it, they can have a problem with that, right?
yeah,
So, and I've seen that multiple times. So that's what we just have to be aware of as surgeons, whether it's the mouth. I mean, you guys are surgeons. You're in there, working on things and bone and what have you, and all your other, you're using, sharp instruments to work in the mouth. So we all have to be aware of this and placing metals then also. And then the electrical, and or galvanic type reactions. And probably the dental world was the first one into this that I'm aware of, because it seems like it goes back quite a ways. And what really kind of threw me into this realm was actually a case. I'll bring it up when we talk about this case coming up. But the other one, the new one, not new one, but I've been seeing more and more is actually EMF and the electromagnetic fields in relation to especially dental work is what I've been seeing here. I just talked to a patient that I probably helped 10 years ago, maybe 10 now, maybe longer. But she actually had all kinds. She had her face broken, her jaw, and then had to have plates and screws. Also had a broken off, I believe, drill bit or so in there, and she couldn't be around uh, any type of uh, internet at all. When we would talk, she'd run a cable from her house out into the yard, and so she's away from the internet. A microwave would send her into some convulsions. And then after getting a bunch of this hardware out, she just dramatic improvement in life and the different metals. And she had a bunch of amalgam and other things too that she had to go to a surgeon in Spain, incredible oral surgeon over there to get rid of a bunch of these things.
Yeah,
So it's, uh-huh.
I would just interject that Dr. Volz is one of the designers of ceramic implants that I really respect. He's a German practicing in Switzerland. His clinic is Swiss BioHealth,
Mm,
and his implant company is Swiss Dental Solutions. But I really like his product, and in his lectures, he talks about the EMFs and that energy that you're speaking
mhm,
about. And in his lectures, he says that this 5G energy that we're all getting exposed to is
mhm.
really going to affect the metal dental implants that people have. It's going to cause a lot of failure in his opinion. But he spoke about that 4 or 5 years ago.
Yeah, I just listened to a gal. She was a dentist, I think a biologic dentist, talking about that exact thing. And she had a titanium implant. And
Yeah.
she, keeps her phone away from her mouth and all this. And actually, I worked with another professor, same thing. She couldn't hold her phone up. I took the screws out of her foot. Actually, we have her coming up here too, so I'll talk about that when it comes up. So, yes, a number of things I keep getting, kind of slapped in the face with this EMF. I actually worked with a doctor down in California who she specializes in this, and then has to basically shut down the internet around the house. Working with it was a autistic child and who wasn't making progress at home. Worked with the mother and then the sister. They had to shut off all devices. He jumped a grade level like within a few weeks or so. And then he was doing great, and then he just regressed and all this. Well, the sister had went and snuck the Wi-Fi back on,
Uh-huh.
and because she wanted to communicate with her friends and all this, and so yeah, it's pretty interesting how this can affect. I think it affects things more than we even realize at this point.
I
So
I agree 100%. We're really are I just think the powers that be aren't protecting us from this. This is a big problem.
yeah, well, we need to really look at what is really out there and not what we want to be out there.
Yeah.
So to help protect our patients at this point. So, currently I'm working with physicians, surgeons, dentists, professors, corrosion engineers from around the world. And I get consulted a lot from patients and or people that I help at this point. And I have to say majority of these patients have dental metals and that I believe are affecting their overall health and potentially reacting with some of their orthopedic metals. So again, to keep everything in mind. I think the dentists have to be asking the orthopedic, have to be asking their patients about the orthopedic metals they have, and you'll see why in a minute. So, but here's a stiff person syndrome. This is a gentleman. He was an engineer, metals engineer, actually worked at local dams, and he had toes that were curling down, and he was getting sores at the tips of these toes, and he had neuropathy from his knee down, getting these ulcers, and we tried everything conservative, couldn't figure anything, nothing was working. So well, we have to I have to operate, straighten these toes out, and then on the bottom he's getting these preulcerative lesions. So I had to end up shortening the bone, and you can see the second and third metatarsals with 2 screws in each. And I straightened the toes, fused the joint there in the toes, and okay, everything was great. No sore tips of the toes anymore. These screws are just small. It was back in the day. Okay, see you later. He did great. He ended up coming back, 4.5 or 5 or so years later, and he had a problem with the big toe starting to curl down. So I had to straighten that out. But then he had all the swelling around where these screws were, and I go, "What's going on here?" And I go, "Does that hurt?" He goes, "No, my neuropathy now is over my entire body." And so I'm just kind of, okay, well, you may be having a reaction here to these screws just from the swelling I'm seeing. So we don't need them anymore. Let's get them out. And then I'll use titanium. So since those were stainless steel, I go, you may have a nickel allergy, and which is the most common. So we use titanium on the big toe, which we did. I had to fuse that straight too. Then it ended up we had problems with that too, and that all had to come out. But so ended up removing those screws, and he came back like the second post-op visit. So it was about 10 days, and he's going, "Okay, doc, we need to talk here." And okay, and he goes, "I started looking back at the metal that was placed in my body." And he goes, "About 6 years ago, I ended up having an ACL repair in my knee. Prior to that, though, I had these old amalgam fillings, and then I had 2 gold crowns in my mouth, and then had this ACL repair with a titanium screw 6 years ago. And 4 years ago, when I started about our little further, I guess it would have been. I guess that was when prior to him seeing me for the first time. And then he had this neuropathy that developed. And then I did surgery on his foot. And he goes, I didn't put it together at that point, but 3 months later, I started having, once I look back, I saw when this started happening, where went in and my whole body became basically paralyzed. He goes, I could breathe, but I couldn't talk and I could not move. And it started 45 minutes a day, progressed to an hour a day, 2 hours a day, 3 hours, up to 10 hours per day. And so he ended up being totally disabled because of this. He saw docs over at University of Washington, did genetic testing, went to Mayo Clinic, and they basically said, "Sorry, you're just going to be in the wheelchair the rest of your life, and your wife will eventually have to put you in a nursing home." And he was in his 40s at the time when this first occurred. So ended up took the screws out, and he came in, that's what he said, "Okay, you took these screws out. I went from being paralyzed 10 hours a day to approximately 3 hours a day overnight." He goes, "I know something's going on here." So that's when I was already working with immunotoxicologist over in Sweden and Europe at the time. She was the inventor of this ELISA test, so I sent his blood over there for the test. Found out he was allergic to nickel, and also he was highly, highly allergic to palladium. And you, being a dentist, will know where this is, but none of us other doctors knew where palladium came from. I didn't know where palladium was from. And well, sure enough, he got the spec sheet on his gold crowns. They were 26% palladium.
Yeah.
So,
Yeah.
so
Palladium's a common element to add. Got to toughen up the gold.
yeah, because gold's too soft, right?
Yep.
Yeah. So, what other types of things are used in gold to toughen it up then?
Platinum.
Hmm.
So gold and platinum is common. We'll put some copper in there too
Hmm.
sometimes. So we have oh gosh, we probably have 1,000 alloy combinations that we could write for if we told
Hmm.
our dental lab exactly what we wanted. But most dentists don't do that. What we do is we'll order a classification of metal. And the simple classifications in dentistry are you have non-precious metal, you have semi-precious, and you have high noble. And the high
Right.
noble classification has 50% or more precious metal, which would be gold, platinum, and palladium.
Right.
Okay. If you have 50% or less, then that's a semi-precious. And then there's
Hmm.
there's crowns made that have absolutely no precious metal in them, and those are non-precious metal crowns. They all
Right.
make good crowns from the standpoint of holding a tooth together.
Hmm.
And if that's our definition of success, okay, or holding a tooth together and also holding ceramic in place. So when I was a young dentist, that was what we did for cosmetic crowns, is we'd have a metal superstructure and ceramic would be baked onto that. And okay, so it looks like a tooth to the patient when they smile, but it doesn't look like a, when you know what you're looking for from a dentist standpoint, you can see the metal edges that are still not covered with the ceramic. You don't need to cover every last bit of it with ceramic. And so there would be metal edges left over, or in many cases, you would only put the ceramic on the side of the tooth that smiles, and the biting surface would be 3/4 just metal. And that way you don't have any ceramic to chip off. You're actually chewing
Hmm.
on this very, very tough metal. Um, so anyways, those are the to
Right.
answer your question, those are the metals that are in dentistry. Of
Yeah.
course, we can also, so for the non-precious metal crowns, they have nickel in them.
Yeah. Right. Right. So, well, so that's like a PFM, or porcelain fused to metal crown. Uh,
And the PFM, that type of that sounds, PFM stands for porcelain fused to metal.
mhm.
Okay, that's what that is. There's another acronym we have. CVP is ceramic fused to CVP, ceramic. I forget. Those are just typical name
Yeah,
abbreviations
you're
we
just
dentists.
using them all the time. Yeah. Yeah.
Yeah, we just throw those names around. But what that means is you've got ceramic with a metal superstructure under it, because the ceramic of the time was not strong enough to make 100% ceramic crown that would not break in the posterior teeth. Some of these weak ceramics, when I was a younger dentist, we would use those maybe in front teeth, and you would have an all ceramic crown on your front teeth, but you wouldn't put that in the back because the patient would break it in a matter of months or something, or
Yeah.
days. So we always put the
Yeah.
metal in it. Now today, they've, over my whole career, ceramic has become stronger and stronger, and we now have very strong ceramic crowns. And I'm, for the past 20 years, probably, I've been putting in 100% ceramic crowns all the time with great confidence that it would be very durable. And they have been.
Yeah.
And that same ceramic is what we make our implants out of today. And they're very, when we're doing metal-free implants, which is what I do, we use these zirconia implants, and they work wonderfully, and they're very, very, very strong.
Strong. Right.
There's your
Right.
screws.
Yeah. There's those little ones. Those are the ones that paralyzed this gentleman. And
Yeah,
but he was still paralyzed for up to 3 hours a day after I removed them. Okay. So that's when we got the testing, and then found out he's also allergic to this the palladium. So that's the first case that I had steer me to the mouth. And
gotcha.
that's where I started, looking for a connection, and then started asking my patients about dental methods. And, some of the other surgeons thought I was pretty crazy for asking that, but I never really at least got the impression that the patient was thought I was crazy. It was more other doctors, and I really didn't care because the patients were getting better, you know? And
Yeah.
and then he got the last gold crown out. He hasn't been paralyzed since.
Is that big screw from his knee?
That was his knee. Yeah, that was a titanium ACL
Yeah.
interference type screw. Yeah, to hold
Yeah.
the ligament in. Yeah, and he didn't need it anymore. The bone had integrated into the repair, the ligament transfer, so he didn't need it. So and yeah, but anyway, so that was the big reason why so that's what steered me to the good old dental side of things.
Yeah.
So and he had the black oxidation underneath his gold crowns and that type of thing. So this gal was a teacher. She was ended up with a number of screws, stainless steel. Well, she had stainless steel originally when she was 16 years old, and then she ended up having issues, and so I had to do some more surgery. We ended up using titanium in place of those because she had problems with She knew she had problems with earrings, and so I figured, oh, probably a nickel allergy. Uh, and do you want me to kind of go through, at least have one of the voice memos?
Oh, yeah, those are powerful.
Remember? Yeah, yeah, yeah. So this one was actually one I presented to the FDA, and so she had come in, and I had put did her surgery. She did fine. Left, came back a number of years later, and said, well, one of these screws start to irritate. Can you go ahead and just get these screws out? I said, sure. So I was doing the pre-op. We were just going to do them in a little surgery center because they're pretty straightforward. And so then I start looking at her medical history, and here's all these medications, and all. Then I go, what's going on? And she goes, "Oh, these medications are for my fibromyalgia." I go, "Well, how long ago did you get fibromyalgia?" "Oh, about 2 years ago." What else you have?" "Oh, this severe chronic fatigue. That." I go, "Well, how long have you had that?" And she goes, "Oh, about 2 years." And I go, "You have any other metal in your body?" And she goes, "No." And I go, "How about?" Because everybody forgets about dental metals. And so I go, "How about dental work?" And she goes, "Nope, never had a cavity." And I'm going, ah. She goes, "Oh, but I have this, stainless steel bar." And I go, "Oh, so you had braces?" And she and she goes, "Yeah, yeah, yeah, I had braces." And I go, "Well, when did you get your braces on?" She goes, "Oh, about 2 years ago." And then I go find out when you got your braces on. So she went to found out. She comes calls me back later that day. "Oh my God, I went and talked to my orthodontist. I had my braces at the end of August, and then the beginning of September is when I had all these symptoms that just started. My chronic fatigue, and then the fibromyalgia." And so I'm going to have you though listen to her. And typically this will come through pretty well. This, like you say, this I presented this to the FDA, and you'll be able to hear her issues here. Around 2016, beginning of, uh, we were having some symptoms with a screw, so we decided to get it out. And then we realized you were having a number of different symptoms, some fibromyalgia type symptoms you were diagnosed with, some chronic fatigue. And we decided to get you metal tested, found out you were allergic to titanium dioxide and nickel and vanadium, both of which titanium dioxide and vanadium were then the titanium in your foot. So we decided to get that out. Also, you had a stainless steel bar with 15% nickel behind your lower teeth. So what happened after we got the titanium plate out of, or titanium screws out of your foot?
So almost immediately after you took the screws out of my feet, I noticed that almost all of my body pain and my migraine symptoms had gone away. And within a couple of weeks, actually, all of my rosacea had cleared. So I was able to stop most of my medicines within a month. I think I was taking 18 different medicines for fibromyalgia at that point. And then shortly after that, I made an appointment to take the bar out from my teeth. And since then, I take one pill a day for my migraines, and that's it.
Okay, thanks. So, what do you think about that?
Yeah, that's those those dental metals, Something you think,
And
you think that retaining bar that we use to retain teeth and we glue it to people's teeth, you think that's benign. And for many people, maybe it doesn't cause them problems, but for some, it is, and we're clueless about it. We don't even think about it.
yeah, yeah, and this patient, we ended up getting her tested, and indeed, she was allergic to nickel and to titanium. And but I think it was the nickel that really did her in, because it wasn't until she did fine until she got the braces.
Yeah,
She did fine with the titanium in her foot, but then she started having problems even with the foot after she got that too. That's why she came in. So that's
yeah,
where I'm thinking these reactions are going on. And then we go willy nilly, putting quote, a bar in that you're going to have. It's going to be a permanent retainer, and it's
yeah,
stainless steel. Well, 18 plus or minus percent, according to the FDA of America and probably the world, is allergic to nickel, but we're putting it in everybody. That does not make sense to me.
yeah, yeah.
So and again, that comes back to informed consent also. And that we have to tell people that this what we're putting in can potentially cause some issues. So
Yeah. I
um,
have I have
mhm,
some pretty sophisticated patients that have become aware of these metal issues, and or we've maybe addressed it because we're talking about other metals that are in their mouth, and then they ask about their retainer, or I'll mention their retainer, and we've taken a fair number of those metal retainers that are, as you say, permanent retainers, remove them. It's not difficult. And then if you want to retain their teeth, you have to, you just use another system. You don't have to have a metal retainer. Some people like the metal retainer because they ask for it because they don't want to wear the suck down retainer, or they don't want another type of bulky retainer. The
yeah,
nice thing about the bonded one, the one that's permanent in quotes, is that the patient doesn't forget to wear it. It's just there,
right.
you know.
Is there
But
is there a way, John? Is there a way to with the lab to fabricate a carbon fiber type device or
th-
something that?
there are, and
Yeah.
these have been around for a long time. You got little Kevlar fibers. You can lay
Okay.
a Kevlar fiber instead.
Yeah. Yeah. That's what I'm talking about. Okay, so they are available. I was wondering that.
Yeah.
Um, yeah.
And
So yeah, that I mean that in my mind that's the go-to. You know,
yeah.
you
And
just
that's
avoid the metal altogether. You know.
yeah. And there's people that, you could, you know, the the common name that we dental talk about for a retainer, that we make a mold and we suck it down. That's called an Essex retainer, by a lot of guys. But like all these aligners that are out there now, Invisalign is probably
Mhm.
the most common one, but there's half dozen other companies now doing what Invisalign does. But those are plastic that have been sucked down onto a mold, and those make a nice retainer. They're only a half a millimeter thick, but you have to remember to wear them.
Right.
If you want something that you don't have to think about, then the Kevlar fibers bonded to the tongue side of the tooth, just like that metal bar was bonded to the tongue
Yep.
side of the tooth. They work very well at stabilizing things.
There you go. There you go. So then we get into the positive and negatives, on the metals. And more positive metal is the cathode, more negative metal is the anode. And that's where I started getting into things and started asking why was this gold interacting with my, stainless steel? And also then we look at, all metals in the body will corrode, period. They're going to corrode at what rate? That's the question, And then if we do have dissimilar metals, the least noble metal or the more negative metal becomes the anode, and then typically that is what is going to corrode faster as far as that goes. And then we can get into the battery type reaction between two dissimilar metals implanted in the body. And here we have the cathode, anode, electrolyte, in the body, electrolyte fluid. Then we have a battery. So you hear in your world, okay, yeah, the battery type feeling in the mouth, the metal type feeling, with certain metals and that type of thing that I hear,
Yep.
commonly. I'm sure you have too. Same type of thing, in my mind anyway. Is that what you feel is going on?
Yeah. Yeah. People taste metal, and they'll tell that's these electrons, or
Hmm.
the ions moving around, and they're actually able to taste that. And you could have, shocking little feeling, when you're like holding a screw in your mouth and you've got metal dentistry. That screw will make for a different type of battery the minute that screws in your mouth, or a fork. I have one patient that never could eat with metal silverware because of the galvanism reaction that he'd have and make his teeth hurt. So he would never let me take his mercury out. But I always was telling him, Dave, let's take these mercury fillings out. I bet you could actually use real silverware. But he was
Yeah,
he was very fearful of the dentist, so we never got around to that, getting
right,
everything out.
right.
But yeah, you put as a if you put a piece of aluminum foil in your mouth, you'll taste that metal quickly.
Yeah, yeah. That's a gum wrapper type thing, and
Yeah.
yeah. So here we're looking at the resting state of a nerve, and this is just what we're taught in our medical training. It's about minus 70 millivolts, but then the nerve fires off, or the action potential fires off at about minus 55 millivolts. And so really there's only about a 15 millivolt change between firing off. And so then we start looking at, okay, how much how much of the body's function involves electrical impulses, and especially electrical chemical impulses, and pretty much all of it. I mean, for you to listen to this, people to see this, I mean, it's all electrical or chemical electrical type of impulses that are firing off here. So I started looking, and actually presented this to the FDA when I started wondering why this was happening between the foot and the mouth. And so I wanted to work with one of my neurologist colleagues who does a lot of diagnostic testing. And I wanted to use some of his equipment. And he goes, well, really, actually, what's going to work better is get a high quality voltmeter and then get some ultrasound gel. And I wanted to test between some of the titanium, plates or screws that I remove, and some of the stainless steel plates or screws that I remove from my patients. So here's the baseline, zero point 0.1 millivolts, okay? And here's titanium plate and a stainless steel screw, 151 millivolts. And these are just, these are readings just to say, hey, there's a potential difference there. The
Yeah.
big question is, what is this doing then, especially in the body, this potential difference? So then I'm going, hey, I think I'm having a problem between the foot and the mouth. So I ran this, down my Hot Wheels track. I presented this to the FDA in my kitchen, and it's still 68 millivolt change. Actually, the test I redid this, for this presentation in Istanbul. The one it was even higher, that I had done for the FDA. But so then when we were back there, at the FDA, somebody said, hey, this would be nice if we could do this in vivo. And I go, well, I think I can do that because I'm removing metals from the foot. Then we have metals in the mouth. And so I just need to have the electrodes going back and forth. The big problem was finding something sterile, in the foot. And we just found out we could just use a cautery probe and just cut the end off of it and plug it into the voltmeter, hook it up to the
Yeah.
voltmeter plug. And that's what we did. So here's the good old lingual bar we talked about, right? And maybe an older one or so here. And then tested titanium up. Sorry. So anybody looking, we have some bloody things going on here. And so anyway, this is titanium plate and screws. So here was the reading. And
Oh my.
minus 158 millivolts, between the foot metal and the mouth metal. And the plus or minus just depends on where you put the probe. I mean, if you have it hooked into positive or negative, and it's really the potential difference between the two. So then what I did, I took it out. So I went from the bone to the lingual bar. Okay, and then it was plus 35. So
Yeah.
it was 193 millivolt change before and after. And I've done, and just kind of again get a baseline, I did testing just from like the soft tissues of the foot to the soft tissues, the inner gum of the mouth or the cheek, or the bone in the foot. And typically it was in the range of 60 to 80 millivolts was kind of quote the average normal. So just to get an idea. But this obviously with 193 millivolt change was much higher than that, right?
Very
So,
good.
and here's our gold crown, good old gold crown. And I get it as far as, okay, this is going to hold up and all this stuff, good noble metal and all that. But again, more noble is more positive, right?
Yeah.
And and here's titanium in the toe. This is a screw I had to remove from a toe. And, minus 340 millivolts. And in that case, then I did it to the bone, and it was minus 37. So it was about 300 millivolt change. And I found that pretty consistently with gold. It was in the
Yeah.
300 millivolt change, before and after removing the foot metal. And with other amalgam or PFMs, it was in the 200 millivolt range difference. So and then this was a gal. She had titanium in her foot, and here's the good old amalgam. And she was minus 154 millivolts, and then went to the bone, to the amalgam, and she was 7.1. So she was 161 millivolt change before and afterwards. And she had some pretty significant changes right afterwards. And part of this was also then emotional. And Some was definitely pains and all this, but some of the emotional side of things. You haven't heard this. Let me just have you kind of listen to this as far as the emotional side of things go.
So 2 weeks ago, we removed multiple titanium plates and screws from your foot. And how do you describe your emotional state prior to the hardware removal?
I was highly emotional. I was very labile. I was depressed and cried. And 75% of the day I was crying. And I had my husband's big hanky and cried myself to sleep every night. And would wake up in the morning and open my eyes, and I was so sad. It was just hard to even carry on to continue to live.
And since getting the hardware out?
I feel brand new. I feel alive. Haven't cried in 2 weeks. It makes me cry to even think about that. I'm happy.
Right. Okay, thanks.
So what do you think about that?
Yeah, that's fantastic. And that makes me wonder just how much of, we have a very, we have a lot of mental health crises in our country. Many folks are depressed. How much is that related to the metals that we've got in their bodies?
Yes, and what I wonder, and she had amalgam in, right?
Yeah.
So and she ultimately got the amalgam out.
Yeah.
But it just makes me wonder because mercury is a neurotoxin, and
Yeah.
if we truly started having a reaction between the titanium and the mercury, because I've seen this in multiple patients with mercury fillings, that I put titanium in, and then they have these emotional issues, and I'm wondering if it's causing if it's just all electrical, or if it's causing some reaction to release the amalgam, to increase the mercury levels in the body that's contributing to the neurotoxicity or the symptoms. I don't know. What are your thoughts on that?
I've always, I guess, through the different courses that I've been through over time, and we're talking about this galvanism issue, I've always felt that felt that my instructors were telling me that the mercury was the easiest element to leave the silver mercury filling. So you got that mixed, if you have a mouthful of just amalgams, then the mercury is going to be what's going to come off. If you have a gold crown or a semi-precious crown or non-precious crown added to the mix, then you're going to pull off mercury even faster because you've got that other, that cathode in there that supercharges it. And then we take a crown and put it over a mercury filling. So now you have a very intimate battery with dissimilar metals all on the same tooth. Now we've probably turbocharged it and supercharged it. And so
same type of thought process. Yeah.
Yeah, this is the stuff I think about and tell and mention to people about these galvanic reactions. The mental part of it, I know I can't. I would say for some people they feel depressed or there's a wonderful book that I refer patients to all the time. It's Dr. Ziff and his father Sam. They wrote a book called Dentistry Without Mercury, I believe's the title, and it's got wonderful pages of just the symptoms that mercury causes, and depression is one of them that's on there. And we know this from industry, because we've been using mercury in industry forever to separate precious metals from the ore, and the people that or in the felt making industry, people get mental illness in those jobs. That's why in Alice in Wonderland we have the Mad Hatter, because all we do as a population, that people that were in the felt making industry, they went crazy. And that's just not something that whoever wrote Alice in Wonderland made up. That was a common knowledge. So yeah, I do think that the mercury is a definite problem, and there's a big source of it there right in people's mouths. And
Yeah.
one filling is a problem, but many people have many more than one. Many of my patients have come to me with 16 mercury fillings in their head.
Right. Right. Well, that's one thing we're working on. I want to try to get down to kind of the brass tacks rather than just having all these patients with, symptoms and okay, this goes away and why. I want to know why and want to start looking at, okay, what's going on with these metals in the body.
Yeah.
So some of the explant studies that actually I'm going up, like I say, going to work with them tomorrow up in Canada. But we're doing a study with these corrosion engineers, and we're evaluating these metals that were placed previously in patients' bodies, and now we're looking at them with the scanning electron microscope. Also using what's called E.D.S. to kind of look at some of the breakdown of the metals, but also then inductively coupled plasma mass spectrometry, which actually, like I say, breaks it down to a thousandths of a percent weight. So it can be very specific with some of these metals that come out of the body. So this is one of the SEMs that we use, and put everything on this tray and put it in. It's a vacuum, and then we can look at things. And here is actually a clip, and this is one thing we don't think about a whole lot. That these gallbladder clips and thyroid clips, all these small clips, and these are put in and not even documented many times. That they're put in. One of the cardiac surgeons that I talked to goes, "We don't document those. We just use them." And I go, "Well, you
What
need
are
to
they?
document
What are the clips used for?
vascular clips."
So
So
they're using this to shut down the blood flow so it stops bleeding in the area that they're doing the surgery, and then they just leave them when they close the patient.
correct, because it's just fast and easy. But
Yeah.
also like gallbladder, they do the ducts,
Uh-huh.
the ducts. So let's clamp them off, cut them, you're gone, And so yeah, but like a gallbladder surgery, maybe five or so of these plus or minus, And
What's
so
the
here,
what's the
yeah,
what's the clip? What metal is the clip made out of?
a lot of the gallbladder ones previously were my understanding. I'm not a that type of surgeon, but from my understanding, were stainless steel. But then they've gone to titanium more. And here is
Yeah.
actually a titanium clip right here.
Yeah.
Here it is under
It's
the
a lot of
electron
corrosion.
microscope.
It's a lot
Yeah,
of corrosion.
yeah, exactly. Does that look inert to you?
Yeah.
And,
No.
and that's what a lot of these surgeons tell me that they're told these are inert. Well, who's telling them that? It's the reps. And these are not inert. And I actually told the corrosion engineer that up there, and worked in the body. I mean, he's actually taken orthopedic implants out and looked at this, and so I said, yeah, the surgeons feel that titanium's inert. He goes, inert? Titanium's not inert. Especially when you put it in the body, an electrolyte of the body, it's going to corrode. So anyway, so here was a patient who was completely disabled in his 50s, and he had a back surgery, fell off some scaffolding. He was, at the top of his game, had this company, multi-million-dollar company that he was working for, and actually lived in a multi-million-dollar house, and fell off after the surgery. He just totally lost it. I mean, his family disowned him. He was committed to the psych ward on a number of occasions. Just chronic issues. He ended up with 42 different diagnoses. I worked with them trying to figure this out. The hospital wouldn't let the surgeon remove the metal, even though the surgeon was ready to go remove it. They said they had to go through the ethics committee to allow him to remove it. So we finally removed it. We did find out he was allergic to nickel, sent his blood off to have that checked, or he had that done. And then here was his titanium. And you can see the striations over on the left-hand side, and here's all the corrosion.
Yeah.
And where did those metal ions go?
Yeah. Yeah. You're talking about the metal ions. They do. This is back to Dr. Voltz's
Mhm,
presentation in Switzerland, but they've done some cadaver studies with patients that had titanium implants, and they looked
mhm,
for where did the titanium go, and it goes into the bone and into the tissue. I want to say I forget exactly the quote, but when they're sectioning that tissue, it's like 10 millimeters away from where the implant was, or maybe it was 10 centimeters, but it's not just staying stable in that dental implant. It's leaving the area where the bone
Yeah.
is bonded to it. Those and titanium is not as benign as as we've been led to believe. I mean, we have titanium dioxide in our sunscreen, and now we're spreading that on our skin, which now gets sucked into our skin because what a great organ the skin is for absorbing stuff, right?
Yep.
So,
Right.
those lecturers are saying, don't use the titanium sunscreen. Use stuff that has another type of barrier if you feel
Right.
like you need to have some barrier.
Yeah. Yeah, they do try to use that titanium dioxide because it's a larger molecule, so it doesn't absorb, but things can still get absorbed. And then the titanium, they do ion testing of the blood so they can actually see the levels in the blood. So we know that this gets into the blood and goes throughout the body through the vascular system.
Yeah.
So that's a problem. And here was the ICP MS, and here are all the different metals, the trace metals from his hardware. And even though it was just the Ti 6Al4V alloy, but these were all the different metals within that. So that's where the problem comes in.
Yeah.
With some of these trace metals, and you can have reactions to these. And there's a Harloff article that describes this. And they did a bunch of these, and even pure titanium, they ended up with a bunch of these different, basically impurities within them,
Yeah.
and trace amounts, including nickel.
Yeah.
So yeah. So the nurse that we had talked about earlier, this was her implant that I had removed myself. Her plates, I removed all of her hardware, and it was just 5 months afterwards. And here was the titanium. And is that inert?
Yeah. Yeah.
I
And
mean,
those
it looks
black
like
lines
the
don't
Mojave
alert.
Desert or something. Yeah.
Yeah.
So again, where'd all that go? So yeah, and this is some corrosion again. We may have to give a warning as far as some of these slides, but this is after about 4.5, 5 months after a plate and screws were removed, and all that black tissue is titanium. It's titanium
Oh,
particles. I've sent that off to pathology, and it came back to titanium particles after just 4.5 to 5 months.
wow.
Yeah. So these metal ions are coming off of this metal. And again, it's
Yeah.
not everybody. Yeah, this may be in my cases, about 5% or so that I'll see this black tissue. So
Uh-huh.
it's not everybody by any means, but it's some people. And do we know why it happens in some and not others? I don't know if we know that totally at this point in time. And we definitely need more studies. We need big institutions. We need NIH funding to look at this further. Because this just dramatically affects certain people in our world here, and dramatically so, as you're seeing in some of these cases. So
Yes.
yeah. So this is just a gal. I'll just have you listen to her real quick. And this was another one of these where she had amalgam fillings, and then had titanium in her. And I'm just going to have you listen to her real quick.
All right. So you had some reconstructive right foot surgery with titanium plates and screws. And just recently, this last week, we got the plates and screws out. And prior to that, what did your body feel like?
Since June, I have been experiencing all over body pain, fatigue, joint stiffness, and then nerve pain in the foot and going up the leg to the back.
And what about your focus or?
I've been in kind of a brain fog since the surgery. I thought it was the anesthetic for quite a while, but 4 months later, it really hadn't worn off much. I wake up in the morning and I feel like I haven't rested at all. I get home at night and I just can do nothing because just going to work has been enough, and it's just been mentally taxing.
And since getting the hardware out, what have you been feeling?
The first thing I noticed when I went home was a lot of energy and feeling like I just was thinking clearly. Other than the local pain from the surgery, the overall body pain was gone. My back pain was gone. The nerve pain is gone. The aches, the joint pain, all gone.
All right. Thanks.
So that's the type of things I see, and
That's so
again, amalgam.
that's so impressive. Yep.
Yeah. So, yeah, and this was a university professor that had two PFMs, or sorry, two crowns, PFM, and then had previous root canals. Um, that she was told she had titanium and stainless steel posts. We believe, though, after testing these, that they were both probably titanium posts and root posts. And she was tested. She was positive for molybdenum, which is in stainless steel. Also, she's one of the ones that I've patch testing is difficult for titanium, but she was positive for titanium and vanadium. And she had severe restriction of range of motion of her shoulder, and her face would go numb holding her cell phone to her ear. So there's kind of we're to the EMF with that. And she had some degree of arthritis in her shoulder. And I'm not a shoulder doctor, but she was told she needed uh, basically a total shoulder implant by two different orthopedic surgeons. And she ended up had heard she actually wrote a book on called that on mercury actually, and she ended up hearing my FDA talk and wanted to quote me in the book. So I said sure. She told me what she was writing and she sent it to me, and I was very impressed with that. Anyway, she called me and said, "Hey, can we talk about this?" So we did. We ultimately found out she had uh, not only the PFMs in her mouth, but also tight or stainless steel screws in her foot. So she flew out to see me to remove the screws in her foot, and so we did the testing, and between them, and here she was, minus 148 millivolts between the PFM and the screw, and then removed the screws, and then tested to the bone, and she was plus 60. So she had a 208 millivolt change before and after. Now the thing with this is the next morning, she ended up she actually ended up staying at her house. So because I talked to her, we stayed with my wife and I, and so I went to take her at the airport, and I went, okay, I'm going to come down, get your bags, bring you up, and she's crying, and I go, what's going on? Is the foot hurting? She goes, no, it doesn't hurt at all. But look, and she lifted her arm over her head. She goes, I haven't been able to do that for 2 years, and my shoulder does not hurt. So, I mean, that rapidly, and what's going on between there? Well, she ultimately then had here is a screw under SEM, and here's just some of the things that we saw with some of the screws, and she actually has titanium particles in the stainless steel screw, and we don't know why those are there. But here was her dental work, and she ended up having the on the left is a glob of amalgam with a titanium post, and that was sitting under the PFM crown.
Yeah.
So there's your whole battery thing you were talking about, and
Yeah.
then there's the other porcelain and the root, titanium root post. At least that's what we were told on that one. We didn't test that one specifically, but
You you
mhm.
know your question about how did the titanium particles get on the stainless steel screw? That was the question?
Well, that was from the foot though. That came from the foot.
Yeah, right. I guess what I want to just thought it just
Mhm.
came to me as you said that. I would imagine I wonder, I guess what I wonder is how do they mill these screws? And
Mm.
are the machines that mill the screw making stainless steel screws in one setup, and then they're making a titanium screw on another setup? And so the
And what's
particles that are on the machinist,
yeah, yeah.
I don't know how they manufacture it, but I wonder, that comes to mind, are they, are these screws made in a mold, or are
I
these screws made by a screw making machine?
typically I believe they're milled, and I think you may really be onto something there because when we looked at it, we looked at that with actually a guy who is one of the top uh, uh, engineers, corrosion engineers in EDS in the world. And he goes, this, because we looked at it then in EDS, and he goes, this looks like titanium nitride. And that's a ceramic, right? And very, very hard. And so he was wondering if they had coated actually or tried to coat the threads to toughen them up. But
Uh-huh.
I'm really wondering if it came from the milling machine, like you're saying, and they used a bit you know,
Yep.
and a bit that was titanium uh, nitride that, but then things flecked off of it.
Yeah. Yeah.
Yeah, interesting. Yeah,
Fascinating.
I'm going to talk to him about it tomorrow when I meet with him because that
Okay.
makes the most sense to me. That makes the most sense to me because they mill them, and we can see the milling, grooves basically in these
Yeah.
devices. Well, you can kind of see them a little bit here, in some of this stuff. But in this looks like indentations. We're not really sure what happened with this particular screw,
Yeah.
But anyway, so and this was actually the EDS of some of this stuff. And then in her case, then what happened? She ended up getting all the dental work out, and after that, basically, she has full range of motion of her shoulder now, and very little discomfort at all. She doesn't need a total shoulder replacement. She's very excited, and it was all had to do with the metal in her body and the metal in her mouth, and she can hold the cell phone up to her face to her ear just fine now. So
Yeah.
yeah, yeah. So then I started looking at stainless steel and some of the dental things because I've been presenting to some of the dental groups, right? So here's stainless steel to a titanium dental implant, 111 millivolts. And here is stainless steel to a zirconia implant, zero point 0.1 millivolt.
Lovely.
So
That's a great slide.
yeah, what do you think about that,
Mark,
huh?
yeah, I'm gonna need my web guy to take these pictures and put them on our website.
Yeah, I mean, yeah, you're more than welcome to do that. We need to get the word out about this, and
Yeah.
between the two, right? And you're
Yeah.
talking about some of the galvanic, or at least the reactions and the potentials between these metals and or ceramics in the mouth. And then here you go. And so here
Yeah.
is titanium to titanium. And hey, they're the same thing, right? No, they're not. They're different alloys.
Yeah.
394. And so this comes in when you're using actually different titanium implants potentially next to each other also.
Yeah.
You know, different company, or even they may make it differently. I don't know. I mean, that's a
Yeah.
question for the vendor.
Yeah.
And so then here's titanium, there's zirconia. Oh, point 0.1, right?
Yeah.
And then here's two different titanium implants. So here you go.
Yeah.
54 millivolts. So, and then titanium again, the implant to zirconia, zero point 0.1. So this was a gal. She used to work for the FDA, and she was basically a expert in this field of taking when the FDA had complaints, they would put it into these different ones called mod, and then there's another type of specification that they put it into. Well, she was able to group all these together. And I think her company's called Device Events, and actually universities and stuff work with her and to be able to look at all this stuff. But that's what she came up with. There's 25 million adverse device events reported in all medical devices, including all total knees, hips, orthopedic hardware, CPAPs even. And then here's the slide she put together with some of the latest information that, this is through April 2025. There's been 5.1 million adverse events reported for titanium dental implants. I mean, that just seems pretty astronomical for me.
Yeah, it does. It blows me away.
Yeah, and they're saying it's 4.4 million were serious injury reports, and what they're referring to with that is that the lack of osseointegration with this is considered serious. Basically it's just loose, and they had to replace it or get it out or or do something different.
And
So
that's and Scott, that's just osseointegration failure. And maybe there's some periimplantitis failure thrown into there where you just lose the bone little by little around the implant, and then the implant falls out. But you have also integration failure when you do the surgery and it doesn't integrate in the first couple months of what you expect it to. But this doesn't account for any of the other symptoms that we're talking about in all these metals, that patients aren't able to make the connection between their Crohn's disease or their arthritic shoulder, or or their depression, and the fact that they got this titanium implant. The titanium implant's successfully in the bone, but it's
Mhm.
also successfully causing them a symptom.
Yeah, potentially could. And a lot of these things, the titanium I had in the foot, it the bone healed fine. And a number of them didn't even have significant symptoms. Yes, it was kind of swollen and maybe a little sore, um, and but then I removed it, and the bone was healed. But then these other symptoms went away. So yes,
Yeah.
this doesn't even account for potentially the other systemic symptoms. Now, some of these other slides, so this kind of describes some of the timeline and when all this started happening, and people can go back and look at this later. But then here is some of these other things. This is
Go
kind of
back to that slide, Scott. Go back to that,
this,
to when
uh-huh,
things started happening.
right here.
So,
Yeah.
yeah, in 2000, what started happening in these different dates? What changed in 2019 compared to 1997?
Well, I you may know more than I, but what I started seeing is or hearing are all these advertisements for these titanium dental implants, and I don't know if that's about where it was. And then, I mean, I think a lot of people started getting trained in these.
Yeah,
Um,
that'd be interesting. Yeah, that would be good I could check that out a little bit to see how we have amped up our titanium implants over the years as more people have gotten trained in it and more
mhm.
patients requesting them because they
Yeah,
don't want to be toothless,
right.
you
They don't
know.
want to put dentures. Yeah,
Yeah, that's
and
fascinating.
yeah. So that's something for you to kind of look into. But that was my gut feeling is that I just, and every time I hear this, these advertisements and everything, I'm kind of going, oh, okay, is that always the best?
Yeah.
And so there may be other options, like I say, and like say the zirconia and some of these others that they're just getting better and better as time goes on. And that was some of the things fracturing of them is one of the biggest complaints I always heard, or why they say, oh, we need titanium because they won't fracture. Well, I don't know if it's the way it's placed or just the materials are going to be better now, they're designed better, and maybe some of the older ones did fracture. But some of the
Yeah.
better designed implants, they're better and they don't. That's at least what I'm hearing from some of the
Yeah.
lectures I've got.
Yeah, when I was in dental school, they were using ceramic dental implants, experimenting with those, and the bone loved it, but they weren't strong
Mhm.
enough, and they were breaking. And
Yeah.
so dentistry has a bad taste in its mouth from, let's say, in the early 80s when we were doing ceramic implants and they were breaking. A lot of just dentistry in general, just like, well, we're not going to go back there again. These
Right.
titanium ones are working, or at least that we think they're working to a certain extent. But since we have so many failures, they're really not working as well as we think they are. It's or they'll work
Right.
them for a few years, and then they develop periimplantitis and start to go. I've put some titanium implants in my career, and I've had some of them just lose bone little by little around the implant. And
Mhm.
when I start seeing that, I tell the patient, we need to get this implant out of here. Your body doesn't like it. Look at how the bone has fallen off. You can see in the x-rays in a 2-3 year period, the bone is leaving this implant. If we want to put a ceramic implant in this area, we need to make the switch before you have more bone destruction.
Right, because it's going to be harder to, you have to bone graft or what have you, and
Yeah.
then
Yep.
to have a stable base, right, to place it. Yeah.
Yep.
So, and I think anytime there's a metal implant placed in the body, whether it's in the mouth or in in the body elsewhere, we really need to be asking these questions that the FDA already posed to us. And then the Roach article, we need to ask those questions. And actually, I'm involved in some studies up in Canada because they're a single payer system and they're paying for all these problems, right? All these
Yep.
doctor visits, all this. Do you think they want to know if there's a problem with the metal in people's body?
Yep.
yeah, they're going to want to know. And so that's one of the studies. Okay, what are your diagnoses before you had an implant in the body, and then what are your diagnoses afterwards? And that's part of
Yeah.
this study. And then okay, you had an implant removed. Okay, what were your diagnoses before, and what were they afterwards? And that would be good information to know. So,
Yep.
yep. And so then here's a number of things that people can go back and look at, and you know issues with these, and some of the failures to osseointegrate and what have you. And then there's some hypersensitivity reactions, bacterial infections, and then here's all the different things involved here too with some of these implants. So in my study, I went back and looked when I started, doing some of these voice memos, taking notes with some of these patients. So I had 314 patients, kind of starting back in October of 2015, going through November 2021. And so then I found out from all these, I totaled them up, and I had 83 patients, and I didn't even ask everybody. I mean, this wasn't a formal study as far as that goes, but about their symptoms, and 83 of them had life-changing improvements in symptoms after I removed the hardware. That ended up being 26.4%. So essentially, one out of every four. That shocked me when I went
Yeah.
back to this.
Interesting.
So yeah, it's just not, oh, it feels better, where you took the hardware out. It's,
Yep.
my diarrhea went away. My
Yep.
asthma's my paralysis is gone. My neck pain went away. My back pain went away. My fibromyalgia, my chronic fatigue. I mean, all these different things, right? So I think that's why we just need to pay attention. We need to ask better questions. We need to realize, as a surgical community, and I'm including dentistry in that, that we need to realize that yes, when we put these materials in patients' bodies, things can happen,
Yep.
and we have to be able to we have to look out for our patients, just and treat them like family. That's what I always look back, treat my patient like my family member. And am I gonna, look at testing potentially for metals before I have a total knee, or my wife has a total knee or something? Yes. I don't want a nickel-based implant in her total knee that's going to be difficult to get out if she's already allergic to nickel.
Yep.
And so I think with any family member, we would do that. So that's where we come into some of the testing, which we really haven't even talked about at all with this. Well, we have to some degree, but yeah, but so that's what we have to do. But anyway, and then there was a cardiothoracic surgeon that I was talking to recently, and he ended up with similar type findings. I was talking to him, and he heard about what I was doing, and he goes, "Well, I have my own issue here, with some of these patients." So I'm going to have you listen
I
to him.
understand that you've seen some systemic symptoms associated with metals, and you are a surgeon. What type of surgeon are you? I'm a practicing cardiothoracic surgeon. And what type of symptoms did you see? I was seeing patients that had PFO closure devices implanted several years prior to visiting with me. Their symptoms included chronic fatigue, migratory rashes, joint swelling, and fatigue. And then what happened after you were able and what were these the PFO closures made out of? These devices were mostly a skeleton made out of nitinol, which is a nickel titanium alloy. And then once you remove them, what happened to the patient's symptoms? In about 50% of the cases, so first, before we removed them, we tested to confirm that there was a nickel allergy, and about 50% of the time, the symptoms improved significantly once these devices had been removed. Okay, thank you.
So it's not just me, you know.
Yeah.
Other surgeons that are paying attention, understand this. So, and that's just big thing with this high index of suspicion. Obviously, history. You really have to look at the history of metal allergies and any problems that they've had, especially earrings in women, and then just ask a lot of questions. And then testing, the lymphocyte transformation test, ELISA test is one. Orthopedic analysis is out of Chicago, is another here in the U.S. And then dermal patch testing is another option as far as that goes. It can, unfortunately, you can get a haptin response or actually sensitize a patient sometimes with dermal testing. and But these are all tests that can be done prior to putting a metal implant in a patient. But there is contact information and what have you. But that's it.